Mr. Larson, your signs are all over my neighborhood.
Okay, thank you. Okay, good evening, everyone. We will call the meeting of the DuPage County Board of Health of October 8th to order. And if we would call the roll, please, Penny.
Ms. Bottoms?
Here.
Ms. Finch?
Here.
Ms. Geider?
Here.
Dr. Hussein?
Here.
Mr. Larson?
Here.
Dr. Meir?
Here.
Dr. Scouten?
Here.
Mr. Spadoni?
Here.
President Tornatori?
Here.
Dr. Weeks?
Here.
Dr. Wilson?
Here.
Mr. President, you have a quorum.
Thank you. Before we begin with the rest of the agenda, I will get the legal terminology out of the way. Pursuant to the Executive Order 2020-07, 2019 ILEO 20-07, issued March 16, 2020, during the duration of the COVID-19 gubernatorial disaster proclamation, the provisions of the Open Meetings Act 5 ILCS 120 requiring or relating to in-person attendance by members of a public body are suspended. Specifically, the conditions of 5 ILCS 120/7 limiting when remote participation is permitted are suspended. For Section 2.02 of this Act, today's meeting is being conducted remotely and is being live streamed for the public's viewing. This meeting is also being recorded in compliance with the Open Meetings Act. The DuPage County Health Department is the lead agency for DuPage County in response to the global pandemic, and as such, is currently closed to the public except by appointment in adherence to public health guidelines and for the protection and safety of the public and staff. Welcome, everyone. We'll move on to the provision of the agenda under public comment. Penny, do we have any public comment?
We have 2 public comments. The first is from Nicole Mann. Is there a policy protocol that requires transparency for a school district's Board of Education to communicate when and if a positive COVID cases are confirmed within a district, whether during remote learning with teachers and or staff present in the buildings and or during a hybrid setting with teachers, staff, and or students present in the buildings? We also have a public comment from Krista Stewart. Is there a policy protocol that requires transparency for a school district Board of Education to communicate when and if a positive COVID case or cases are confirmed within a district, whether during remote learning with teachers and or staff present in the buildings and or during a hybrid setting with teachers, staff, and or students present in the buildings? And that concludes the public comment.
Okay, thank you. Customarily, public comment is just that. It's a comment, not a question and answer session, but I think if you would, Karen, perhaps respond to both of those people with the appropriate answer at some other time after the meeting.
Sure. Thank you.
Under President's remarks, I've got a couple of things. First, I want to welcome our newest board member, Janice Geider. Janice, welcome to the board. We trust that you will be as interested and enjoy your term on the board as all of us do and will continue to do, and we appreciate your time and energy that you are bringing and will bring to the board, and we all welcome you and look forward to working with you in the future. So welcome aboard.
Thank you.
Tonight we're going to be doing an overview a bit on the budget, at least a resolution to approve the budget. This is what we've gone over the past few weeks. Many of you have talked to Mike regarding it, and presumably it had all of your questions answered. We will be hopefully dealing with that later on. I did want to point out to something that I don't recall if we might have talked about it at the last meeting, but it deals with the flu vaccine voucher. And it's up and running. It was a suggestion of one of our county board members, Ashley Sulman, who suggested that perhaps we could do vouchers for flu vaccines for people who are uninsured or underinsured. We were able to, I was able to contact Bob Larson, who's our finance chairman at the county. We contacted Karen. Karen contacted the DuPage Health Coalition, and before you know it, we've got a voucher program in place. We have $300,000 of the county money from the CARES Act that was allocated. I understand Walgreens is kicking in and will be helping us out. And we do thank the coalition and Bob and Karen and Ashley for making that happen. It's a wonderful opportunity to see various entities of government working together for the betterment of our citizens. Lastly, under President's remarks, it seems like only yesterday, but we have elections that we need to address. The elections of officers. The bylaws provide for elections of officers at the first meeting after the end of our fiscal year. That would be in December. Anyone interested in holding the office of president, vice president, secretary, or treasurer, I would ask you to contact Karen at least no later than a week before next month's meeting. At that point, if there are any contested positions or contested offices, meaning 2 or more people vying for the same spot, we will develop some type of protocol for an election at the November meeting. If there are none and we have one person vying for each spot, then presumably we will submit that and we will vote that group of officers in by acclamation at the November meeting to take place or take effect in the December meeting. So just contact Karen if you're interested no later than a week before next month's meeting. That concludes my president's remarks. Moving on to public health updates, I will turn it over to Karen to give us a COVID-19 update.
Great, thank you. And Adam is going to be the wizard behind the curtain. It's a very heavy curtain, so we appreciate your patience.
Is it not, you're not seeing it?
We are? Yep.
We are.
Yep.
All good.
Okay.
Yeah, you want to put it in slideshow? There we go.
Thank you.
Okay, great. There. Thanks so much, Adam. See, nothing to it. We would like to provide you with some response team metrics, which we feel are important to be sharing on a regular basis to give you a sense of the scope and the work that's being done by the health department teams. And then we also want to share some, I think it's more fun, entertaining kind of concepts that have been translated into our educational campaigns that you've probably started to hear and will be hearing more about going forward in the next few months. So with that, we'll start with our business response team. If you remember, that is one of the buckets that was established early on in the COVID-19 response to really address the critical essential workers and the need for keeping their workforce safe and healthy. It has since just blossomed into an extraordinarily robust team that not only addresses the questions that businesses have, but also fields when I get, which I do on a daily basis, multiple emails from residents with concerns about businesses, that this is the team that takes those complaints or questions and contacts that business. So to date, we've had 850 businesses contacted. We average with this team about 45 contacts a day, but you will see that the range is pretty broad, and it takes at least 15 minutes to be talking with people about either their concerns or the policies that need to be established in a business place. And some of these calls are very intensive and can take upwards of an hour on each call. So that is our technical assistance business team. We also have our school response team and our technical assistance to school. And as you can imagine, this team has been absolutely inundated. This is one of the areas that we are actively hiring temp staff to assist with the number of calls. You see that we've had over 1,000 calls received between the end of June and the end of September, but and so with the breaking down an average, that averages out to 33 calls per day. But I can tell you that the last couple of weeks we have been fielding hundreds of calls, 100 calls, 150 calls a day, as schools find their way through this new normal, are really working. And one of the reasons why we've dedicated as much time and attention to this effort is because the schools are very much interested in doing what's right, what's healthy, what's going to reduce risk wherever possible. And so we want to support them as they do that. Our community-based testing site has continued. We are looking at extending community-based testing availability beyond October 31st. We have seen today's Thursday, so we have seen 4 of our highest days ever. And certainly we have never seen 4 days that we've either almost hit or have exceeded 600 tests. So I think we're up to about 2,400 tests this week alone. Overall, we've had over 27,000 tests. I have a graph after this. Our average positivity rate is currently at 3.78, but we have some interesting trends on that. We are open now 7 to noon, Monday through Friday, and Monday and Tuesday tend to be the busiest days of the week. We've been able to transition most of our health department staff employees back either to other response areas or to the important jobs that they had prior to COVID. We have 5 employees over there on a daily basis, however, leading the efforts of the 48 temp staff. It's one of the highest reaching elements of our social media platform posts. You'll see that we've had almost 500,000 persons reaching out about testing through that medium. You will see, and this is what I alluded to, that the 7-day average positivity of our testing site is on a concerning, I guess, trend. Certainly it's on an upward trend we're seeing. And the next slide also indicates that not only is the, are we seeing greater and greater as this is a cumulative number, you also see the running positivity rate increasing, and hopefully we see it flattening out a little bit now. When we look at a breakdown of where people are coming from, with the addresses that are being listed, you'll see that, Wheaton has a great deal at 5,800, followed by Glen Ellen, our neighbors. But closely behind that is Naperville, and then out of county residents. We have gotten probably at least 1 a week, if not more, formal letters or emails or calls expressing the appreciation for and the level of being impressed by of the community-based testing site. And so we're very, very proud of this very unique testing site that is being, again, run by health department staff. And then the labs and the tests themselves are being provided by the state of Illinois. A lot of the logistical expenses are covered by CARES Act dollars, and county building and grounds, OSUM have all been involved in supporting this effort. And so, yeah, we look forward to what low temperatures and snow does to as we transition into the more winter months. But we are planning on extending that. The other huge area of our response is around the case investigation and contact tracing program. This is the program that the Answer the Call educational campaign addresses. We have investigated and closed 98.5% of all cases that have been identified in the county as of 10/6. Again, we are seeing increases not only in testing volume, but we're also seeing and are keeping a close eye on the number of cases that are being identified on a daily basis. We seem to be on an upward trajectory again. We have kept track of all the calls that we're making, and over 20,000 calls. Again, we have 75 staff who have been trained, and then we have hired an additional 143 staff to assist us in this massive Herculean effort. If you will remember, and were on the board last year, we launched our newly revamped, newly developed, new platform website in the third week of September. And that was a culmination of about 9 months of intensive effort by our staff. And we knew that our other website, our former website, was outdated. But little did we realize how vitally important our website, what a vitally important role our website would be using in 2020. The website has served as one of our primary tools, and you'll see these metrics that our response began the third week. Sorry about that. That is Madam Stella. The third week of January. You see that the activity really went up at the end of March when we launched our dashboard. You'll see that we had nearly 2 million views the first 6 months, really 5 months. And then within the last quarter, little over a quarter, third of the year, we've had another 1 million page views. And you'll see that it is fairly steady across that whole time. So well invested resources. When we look at the pages that have been most frequently visited, which we're now able to do based on this new platform for our website, we see that the main page of our health department has garnered 725,000 views. Next up is career opportunities, birth certificates, and data and reports. But when we break down the COVID-19 website page views, you see that between the home page, the testing page, and the dashboard, that we have seen a great deal of activity. So now let's talk about educational campaigns, because again, we requested and were granted funds through the CARES, the DuPage County Board CARES funds to really promote messaging around COVID-19. So with that, we have used some of those dollars to promote our Stay Safe campaign. We've used the Facebook platform, and I'll whip through these quickly. We've also placed ads with other websites, Food Network, Major League Baseball, the Weather Channel, and these are in Spanish and in English. YouTube. And then this is something that is something to appeal to younger audiences through Snapchat. You can add filters. And so we've provided them the opportunity to apply masks in a healthy and health promoting way. We also have been putting together, and we will begin distributing these safety kits. So in these for adults in these fanny packs, there is a face mask, a cloth face mask, hand sanitizer, and then probably most importantly, the brochure or information on how to help slow the spread of COVID. Kids, we have kids kits that have the same information, both English and Spanish, and are using our partners in the community that serve underserved populations to distribute these. We also have an educational campaign that is trying to empower people to be aspirational, to be that friend, the one, who says, I'm wearing a mask and physically distancing, so I can do my part. We've used a variety of platforms to distribute that message as well. And then another campaign, educational campaign, is Answer the Call. And that is really addressing the hesitancy and the challenges of our case investigation and contact tracing efforts, that people don't recognize the number. The state decided to use a 312 number for all calls regarding contact tracing. A lot of people see a number from an area code or that they don't recognize. And so don't answer, and every call that is not answered results in more work, because we're going to keep calling until we get a hold of you. So, so we have that. We also have, there's actually 2 billboards available in DuPage County, and we have implemented the digital billboard Wear a Mask campaign on those 2. I think these next 2 are fairly creative. So we have ad campaign or educational campaigns in both laundromats and gas stations. Just to remind people, we know that the more reminding that we do, the better compliance that we will receive. And I think you see that we are trying to do so with colors and vibrancy and a positive kind of message across all of these campaigns that engenders people wanting to participate versus shaming or blaming people into, or guilting people into participating. A little bit more information on Answer the Call. We also have ESPN. For a while, we were on the White Sox and the Cubs, thinking that was a great investment as they were trekking toward the World Series, and we all know how that ended. So we're using these other opportunities. There's also a radio ad that perhaps you've heard, and we're going to try to play this one for you.
Come on, Otis, let's go. Oh, hold on. Let me see who's calling. Oh, it's a contact tracer from DuPage County Health Department. Okay, Otis, you get a few more minutes to play. I need to take this.
By answering the call, you can take back the power. Contact tracing is the way we will help slow the spread of COVID-19. The name COVID Contact, along with the phone number 312-777-1999, will appear on your caller ID with all calls from a DuPage County contact tracer. Hashtag do your part, DuPage.
And then
I'm gonna
finally,
wash my.
we have the amazing health promotion team has created this sports themed reminder of the 3 W's. And so that is the update. Any questions? Did I lose everybody?
I have a question, Karen. Were we,
Yes.
those ads, were we able to use the COVID money for those?
Mhm. Yes,
Good. Yeah.
yes, yes,
Good use of money.
entirely. Yes.
Good deal.
I have one question. What's the turnaround time for the test at the testing center? Like if you go on a Tuesday or a Monday, when do you get the result back?
It's between 24 and 36 hours.
Okay.
And it's, we're very proud of the fact that the lab that we have the opportunity to work with offers an online portal. So as soon as the lab pushes out the results, the individual receives an email and their test results immediately.
Okay. And this is a self-administered test, right?
Yes.
What is the testing plan, Karen, after the snow flies and you have to close down the testing site?
Yeah, so we're looking at drive-through, indoor drive-through. Think of a like a car wash or a bay that you get your oil changed in, something like that, so that staff could be protected, but still have adequate airflow. We're also looking at walk-up facilities. We know that we need to continue to test during the winter, and we are looking at having a fully formed testing plan for the next 6 months within the next week or two.
Do we have any plans to transition to the saliva testing eventually?
Once that's available, we're interested in the PCR saliva test, particularly the one that we're most familiar with is the Shield test, and would be very interested in that. I'm sure you probably heard that's on hold for now, but yeah, we are looking at that.
Can I just ask, Karen, you list that 90% or more of the contact trace cases are closed. How do you define a case as being closed?
And so Rashmi, I'm going to have you provide that definition.
Sure. Yes. Thank you. It's basically a case that's been investigated, or sadly, in the 500 plus who have been deceased, they, of course, were not interviewed, but or they may have been interviewed prior to their death, but it's either where they've been investigated or at least enough information was collected, or the minimum number or whatever information could be collected was collected, and then it's closed. There were some early on where we were limited by the information that was collected by lab and submitted, and we actually have a pretty significant effort ongoing now for we have some redeployed dedicated data entry folks who are trying to take the opportunity to reconcile the information that's in some of the newer Salesforce. Salesforce is our case and contact interview management tool, and the state has not yet been able to reconcile those two systems so that data in INEDS, the Illinois National Electronic Data Surveillance System, which is kind of our surveillance system database, we were told and are still promised that eventually we were told that that very soon after launching July 2nd, that we would be able to access data from INEDS and Salesforce and INEDS. That is the case. So since we need access to all of our data in INEDS, basically that stopped happening as of July 2nd. And when we learned recently that that timeline was not known when it would be, when both systems would be compatible, we now have persons that are dedicated to not only closing some of the cases that before had not been, but backfilling some of the data that we didn't have before. So the quality of our data is improving, and we're on track to be caught up at least through the end of September, or through most of our September cases by the end of October. And then we'll have a plan for keeping up to speed onward. So I think the quality of our data continues to improve, even for those cases that were closed, but then also those who are ongoingly investigated and closed. It's basically those who've been investigated with sufficient data. The ones that have not been closed are either under investigation currently and actively part of an outbreak or individual case investigation, or lost to follow-up. But ultimately, even those are closed if we have a lab result and can call them a confirmed case.
Well, and that's, I guess, what I'm trying to ask. I would assume the categories of cases that would be considered closed are obviously the deceased, somebody who has a confirmed negative test result after potential exposure, and then maybe somebody who's beyond the incubation period. You know, how do you determine that you can close the case?
Right. So you probably meant confirmed positive, right? Not
So
confirmed.
No,
in terms of definitions, in order to be a case, you have to be positive. So we don't follow up on negative cases. So just by virtue of being a case means you're positive. So we have reached out to 98.5% of those people who have tested positive.
And the fact of having talked with them and gone through the investigation process is what closes the case.
Correct.
Okay.
Right. So I will say, if I can add one thing, we do have a small number, and that's why we say investigated and or closed, because we do have several hundred that are currently in. So they've been investigated. We've completed the interview, but they're still in isolation being monitored. So those are not closed yet, if that makes sense. That they're still in our system and we're checking in with them daily, at least electronically. So they're still open until they're past their isolation period. So they're technically still open, but they've been investigated. But then as soon as they end their isolation period, then they're also closed.
Okay, just because from a sort of a layperson's perspective, I hear the word closed and I'm thinking they've been checked out and they're now safe, they're COVID-free, they're not at risk of exposure, that sort of thing.
Yes, that's accurate. I mean, as far as we know, I mean, they're considered protected, you know, for at least the 3-month period from what we know and for CDC recommendations. But yes, I mean, we would consider the their infectious period as well as the investigation closed.
Okay, thank you.
Hey, this is Jan Guider. I just for a point of clarification, a case is open when a person tests positive. The individuals who are identified through contact tracing, are they then considered part of that case? And if they are, or if they are not, if they are considered part of that case, is the case closed once the original case person identified has been determined to have either expired or is no longer infected?
It's a good question. So each individual case is investigated and managed individually. So if there's, say, case A or individual A is identified as a case, and then they have, say, 4 household members who are immediately identified as close contacts. So that case is interviewed and investigated and then ultimately closed once their isolation period is over. And then their household contacts are separately interviewed and monitored for their quarantine period. So the case can still be closed while the close contacts are being monitored. And then, for example, we of course have situations where the close contact while being monitored ends up developing symptoms and or tests positive. So then they convert from a close contact to a case. So then their status is changed from a close contact to a case, and then they are interviewed as a case, and then the cycle continues where then their close contacts are identified and entered and interviewed and monitored. What also happens is that when we have two cases from separate households that are associated with a separate entity, whether it's a restaurant or a school or a business or anything, then we have a process where we already are now tracking any facility that has 1 or more cases identified. And then as soon as they have 2 or more cases identified, then we have a set of outbreak assessment questions that we work with their contact, say a manager or school nurse or somebody, to review all of those questions. This is what our respective teams are spending a lot of time and energy on, to work with them to answer those questions. They return those responses to us, and then we review and see, is it in fact that did those 2 cases from different households have any other more likely exposure? Like, did they have a household member who tested positive before this individual case was exposed and tested positive? Or did they have no other likely outside exposure, like in their own households? And was that setting, say the school or the restaurant or the long-term care facility, the more likely setting for that transmission? So basically, when you have 2 or more cases that are epidemiologically linked within that setting, without any more likely exposure such as household, then they do meet criteria for an outbreak. So that's a whole separate system that we're tracking, where we have our outbreak reporting system or ORS, where we are tracking cases, and then we reconcile those within the INET system to be able to make sure that each workplace, each outbreak associated case is also tracked in our INET system. So it's a complex system, and then that's separate from Salesforce, which is the interview management tool. But that provides a different set of metrics, and it's very helpful for the case and contact monitoring. So I hope, does that help answer some of your questions about the case and contacts?
It does, and I'll just ask one more thing, then I'll move on.
Sure.
So a case can effectively be closed because someone who's been determined to be a case tested positive can, if they're not showing any signs in 10 days, that case can be closed, even though you may still have individuals who are under quarantine for the 14 days, still under that quarantine. That's what I'm hearing, right?
Correct.
Okay, thank you.
Thank you.
I have 2 quick questions about testing. Number 1, what's the average turnaround time from test until the person gets the results? And number 2, do we believe in the no news is good? Are we using the no news is good news philosophy, or does everybody get the test results, negative or positive?
Sure. So the average turnaround time for our test site is 24 to 36 hours,
Wow,
and
that's good.
everyone is provided with the test result.
Good answers. Thank you.
Yes, yes, because we want to make sure that people understand it's very similar to other tests. A negative today means a negative today,
Right.
or yesterday when you were tested, and
Yeah.
it doesn't confer any sort of protection in the future.
Good. Good job. Thank you.
Any other questions of Karen or Dr. Chug? I have a couple of questions and a couple of comments. First, I just regarding the marketing. We received an email from the Chicago Bulls this week, and Karen and I have put the right person in touch. They're going to be doing a marketing campaign with us regarding COVID and testing. I can tell you from personal experience, my wife and I both were tested at the site about 7 or 8 weeks ago. We had colds, which lasted a couple of days. I called Karen and said, "What do you think I should do?" And she said, "Get over and get tested." So we did. I got my test results in 48 hours. My wife got hers in 36. So it was very quick, and they were extremely efficient. For Dr. Chug, I have a question about what I'm seeing recently. I thought we had the droplets in the 6-foot spacing down, and we understood it. And now I'm hearing 12 feet and airborne, which concerns me. If it's airborne, then I don't know that 120 feet is particularly good to space out. What can you tell me about either of those two things?
I think based on, again, CDC guidance, which is sometimes evolving, but our understanding is still that the primary route of transmission is through droplet, and that's where the 6-foot and 15-minute parameters are more likely to increase risk of transmission. But yes, there can potentially be aerosolization and prolonged suspension of these micro droplets in the air, especially indoors, especially with poorly ventilated spaces. So I think that's the kind of, so not only especially in indoors and poorly ventilated spaces, but also if there are activities such as, singing or if persons are ill and there's coughing, or so especially, or loud speaking or
Exercising.
Yes, exercising, fitness centers, and restaurants again are a big risk. Indoor dining, if people are seated closely together without masks because they're eating, and then it's loud and they're talking loudly, and so that so those kinds of activities where there's increased expulsion of droplets, especially indoors, can increase risk of transmission. But generally speaking, if everyone's masked and physically distanced, then the risk is certainly lower. I mean, the lowest would be to not have any interaction, which is not practical in all situations. But we know with increased numbers of people and closer spaces and indoor settings that the risk increases, but there are still ways in those settings to modify interactions where risk can be reduced. And that's what we're all about, is risk mitigation.
Okay.
Does that help?
Yeah, doesn't make me happy. It doesn't make me happy, but it helps. Yeah.
I hear you.
A couple of other things that we've talked about before. Every Monday, Karen and Dr. Chug and Adam and Chris get together with the mayors and managers of the municipalities and give them updates on what's going on, and also answer questions from the mayors and the managers. And given what we've seen and for how long we've seen, we've heard about COVID fatigue, and we found that people are very creative in trying to get around the what they would consider the guidelines. Recently, we had a municipality that had a problem with cruise nights, people who would bring their vintage cars and gather around, and we were told that there were as many as 250 or 300 people at these cruise nights at a location where they shouldn't have been, certainly in that number. The police would try to police that area, and were basically given the finger, figuratively, if not literally, because there was really nothing the police could do. The municipal leaders, the mayors and other people came to us. I won't say threatened, but we used some pretty strong language to the organizers of the cruise night, as well as the location where they were, essentially telling them what the law was, what could happen to them, and the fact that the provider of that location also had a liquor license and a license to serve food, that was something that could possibly be in jeopardy if they continued to violate the law. Much to our maybe not surprise, but we were happy that they stopped doing the cruise nights literally the next couple of days. We also had some issues with a basketball group out of Aurora, is it, Karen? A group of probably 300 young people who are playing basketball in teams, but the way they got around this is that they consider themselves all one team. And apparently under the governor's guidelines, you can have intra-squad games with one team. So they've taken this 300 people, 10 people to a team and 30 teams, and called that one 300-person team a squad, and their games are then intra-squad games, and they feel that they're getting around it. We've had some complaints from people in the area, and I know that Karen and the staff are looking into it with IDPA. So people are doing what they can to get around some of this. We understand it. We understand the futility of it. We all know about the lawsuit that was filed against the Illinois High School Association regarding sports, which was dismissed by Judge Fullerton. So I think we're probably going to see more of it as the COVID fatigue even gets worse, and we've got to maintain our diligence and our vigilance in getting that way. And just kudos to Karen, all of the people at the health department for not only keeping us informed, but keeping us on the straight and narrow. Any other questions of Karen on her update by anyone? Okay. Karen, do you have anything else you want to add?
No, that's it. Thank you so much.
Okay, thank you for that. Moving on to approval of the minutes, I will entertain a motion to approve the minutes of September 10th, 2020.
So moved.
Motion by Dr. Wilson.
Second.
Second by Member Larson. Roll call, please.
Dr.
Penny?
Wilson,
There you go.
Yes.
Ms. Bottoms,
Yes.
Ms. Finch,
Yes.
Ms. Geider,
Yes.
Dr. Hussein,
Yes.
Mr. Larson,
Aye.
Dr. Munir,
Yes.
Dr. Scouten,
Yes.
Mr. Spadoni,
Yes.
President Tornatore,
Aye.
Dr. Weeks.
Aye.
Mr. President, the motion passes.
And the minutes are approved. And just so everyone knows, we're going to be doing roll calls on everything because we don't have a physical quorum present, and that's part of the governor's order. Moving on to treasurer's report. Mike, I think that would be in your court.
Thank you, Sam. As of August 1st, the Health Department General Fund balance totaled $29,730,689.45. Receipts for the month totaled $3,261,909.18, and disbursements totaled $3,282,473.86, leaving a month-end total in the Health Department General Fund of $29,710,142.77. Combined balances in all four health department funds as of August 1st totaled $38,458,087.49. Combined receipts for the month totaled $3,659,170.04, and combined disbursements totaled $3,670,520.79, leaving the combined balances in all four health department funds at $38,446,736.74. Investment earnings recorded to the general ledger in the month of August for all four health department funds totaled $5,458.83. Including the August earnings, year-to-date investment earnings for all four funds has totaled $218,618.45.
Any questions of Mike on the treasurer's report? And Janice, for your own edification, because it only took me about 2 years to figure out where this all was in the myriad of documents that we get under financial. It's Schedule A and Schedule C under the financial area, so you can refer to that if you.
Well, actually, Mike reviewed everything with me a couple of days ago. So again, thank you, Mike.
Wonderful, great. Okay, I'll entertain a motion to approve the treasurer's report as submitted.
So moved.
And Lanny Wilson here, second.
Motion by Member Larson, seconded by Dr. Wilson. Roll call, please.
Mr. Larson,
Aye.
Dr. Manier. Dr. Manier. I see her. Okay. Dr. Scouten.
Here, sorry.
Yes.
Mr. Spadoni.
Yes.
President Tornatore.
Aye.
Dr. Weeks.
Aye.
Dr. Wilson.
Yes.
Ms. Bottoms.
Yes.
Ms. Finch. Yes. Ms. Geider.
Yes.
Dr. Hussein.
Yes.
Mr. President, the motion passes.
Thank you. Moving on to consent items, I'll entertain a motion to combine and approve items 7.1 and 2. This is a budget resolution, scrivener's error, and personnel transactions.
So moved.
Second, Lanny
Moved
Wilson.
by Member Larson, seconded by Dr. Wilson. Any discussion on either of those? There being none, roll call, please.
Mr. Larson.
Aye.
Dr. Manier.
Yes.
Dr. Scouten.
Yes.
Mr. Spadoni.
Yes.
President Tornatore.
Aye.
Dr. Weeks.
Aye.
Dr. Wilson.
Yes.
Ms. Bottoms.
Yes.
Ms. Finch. Yes. Ms. Geider.
Yes.
Dr. Hussein.
Yes.
Mr. President, the motion passes.
Thank you. Moving on to item 8, I'll entertain a motion to combine and approve items 8.1 and 3. This is the holiday calendar and grant acceptance.
So moved. Wilson here.
Second.
Motion by Dr. Wilson, seconded by Member Larson. Any questions, comments, discussion on either of those two items? Hearing none, seeing none, roll call, please.
Dr. Wilson.
Yes.
Ms. Bottoms.
Yes.
Ms. Finch. Yes. Ms. Geider.
Yes.
Dr. Hussein.
Yes.
Mr. Larson.
Aye.
Dr. Manier.
Yes.
Dr. Scouten.
Yes.
Mr. Spadoni.
Yes.
President Tornatore.
Aye.
Dr. Weeks.
Aye.
Mr. President, the motion passes.
Thank you. Moving on to item 8.2 is a resolution for salary increase guidelines. These are the guidelines that were established in the 2020 budget, which were approved in October of 2019. So the funding for these increases in the salaries are in the 2020 budget. As you can see on agenda item 8.2 in your packet, there are guidelines. The increases will be to eligible employees hired prior to December 1, 2019. The salary increases are distributed based on job performance. The percentage increase is granted or may be granted from 0 to 4% based on job performance, merit, and overall performance. And in cases where the employee is at a maximum of the salary range and is being recommended to receive a salary increase, that increase will take the form of a performance bonus. I'll entertain a motion to approve the resolution as set forth.
So moved, Jan Geider.
The motion by Board Member Geiner. Is there a second?
Second.
The second by Member Larson. Any discussion, questions on this or comments from Karen or any member of the staff?
I would just, so this presents the guidelines, but we don't know what the actual ultimate fiscal impact of that's going to be until the these guidelines are implemented department by department.
Right. We budget 3% of personnel costs, and so we know and then that sum is then further distributed across service units. So we have the mechanism in place that we don't overextend the merits beyond that amount. Last year, we were actually at 3.01% increase, so very close to the mark.
Any other questions, comments, or discussion on the resolution? Hearing none, seeing none, roll call, please.
Ms. Geider,
Yes.
Dr. Hussein,
Yes.
Mr. Larson,
Aye.
Dr. Munir,
Yes.
Dr. Scouten,
Yes.
Mr. Spadoni,
Yes.
President Tornatori,
Aye.
Dr. Weeks,
Aye.
Dr. Wilson,
Yes.
Ms. Bottoms,
Yes.
Ms. Finch. Yes. Mr. President, the motion passes.
Thank you. Moving on to item 4, purchasing. I'll entertain a motion to combine and approve items 4A through N, unless there is any objection to take any of these separately.
So moved.
Hearing none, seeing none, I'll entertain a motion to approve the items as combined.
Lanny Wilson, second.
Member Larson, seconded by Dr. Wilson. Any questions or discussions on any of these items? Hearing none, seeing none, roll call, please.
Mr. Larson,
Aye.
Dr. Munir,
Yes.
Dr. Scouten,
Yes.
Mr. Spadoni,
Yes.
President Tornatori,
Aye.
Dr. Weeks,
Aye.
Dr. Wilson,
Yes.
Ms. Bottoms,
Yes.
Ms. Finch. Yes. Ms. Geider,
Yes.
Dr. Hussein.
Yes.
Mr. President, the motion passes.
Thank you. Moving on to item 5, the resolution of the 2021 budget. I'll entertain a motion to approve resolution FY 2021.
Lanny Wilson here, move to approve.
Motion by Dr. Wilson.
Second.
Or let
Second
Mr.
by
Spadoni second.
Mr. Spadoni. Any
Didn't
discussion?
spend the big money.
Any discussion, questions on the budget that we have been through?
Has there been any talk of extending CARES Act usage of the funds provided past December 30th?
There's been plenty of discussion. It's been an ongoing issue, but we talk on a virtually weekly basis with our federal lobbyist over at the county. It hasn't been at this point. I'm sort of assuming it's not. The president just indicated he was pulling out of further negotiations on another stimulus bill and then backed off on that. So there's some discussion that may go on with that. But given the current political environment, I don't see any changes being imminent in that regard.
Is the county developing kind of a contingency plan then? If that's, if they need to continue to provide services beyond when those monies can be used?
Well, I mean, the way we're looking at it as a county, we're making sure that we use as much of the money as possible to accomplish as much as we can between now and the end of the year, including the possibility with the change in the recent guidance that would allow us to fully reimburse ourselves for the entirety of our public safety budget, because that's the latest guidance. So we could take the entire sheriff's budget for the month of December, for instance, which is technically the fiscal 2021 budget, because our budget year ends at the end of November, and then spend out some of that money, which would cover some of our costs for next year. But we have a balanced budget already set out for next year, not much in the way of contingency, but we have a very strong cash reserve, as does the Board of Health. We have something like an $80 million cash reserve at the county, so we can address those problems if need be. And at some point, I assume maybe early next year, there'll probably be some additional funding that's provided to the states and local governments, depending upon who's in power and how that all plays out.
Thank you.
Mr. President, I think this was an incredible body of work, very well done. Appreciate the fact that Mike went around to all the board members and contacted us to make sure that we had our questions answered. That makes this process a lot easier here this evening.
Yes, I couldn't agree more. Thank you to Mike and to all of the people who were instrumental in putting the budget together and getting us where they're at. And to those who may not know, Bob Larson's the chairman of the finance committee at the county. He has got a handle on what's going on in terms of the COVID money. I think we can probably say with a certain degree of certainty that we're going to try to spend all the money that we received and distribute it by December 31st on the assumption that that's what we're going to see from the Treasury guidelines. Okay, any other questions or comments on the budget?
Mr. Chairman, just briefly, I hate to pass this year without the comments that I always make every year, which are that sometimes the public watches these and might think because we're going through our entire annual budget on almost a voice vote without a lot of discussion, that maybe we're not taking this seriously, but this is obviously a process that's in the making. A tremendous amount of work by the staff has gone into this. Obviously, the staff has invited our comment and consideration, and I know my fellow board members have looked into this in great detail. Always proud of the work that our staff does in the Board of Health, not only to get to this level of the budget, but through the entire year and the service that's provided while being mindful of the sacrifice that taxpayers make in funding what we do. So I think I'm proud of it. The one thing I'm concerned about is making sure we have adequate funds to fund some haircuts for some of the staff at the health department. Some of those.
I think I know who that's directed at.
I didn't want to name names, Mike. I wanted
Well, thank you, Bob. We all feel the same way, and again, it's a wonderful job, and thank you to Mike and everyone who is a part of the budget. Okay, hearing no further discussion, roll call, please, Penny.
Dr. Wilson,
Yes.
Ms. Bottoms,
Yes.
Ms. Finch,
Yes.
Ms. Schneider,
Yes.
Dr. Hussein,
Yes.
Mr. Larson,
Aye.
Dr. Manier,
Yes.
Dr. Scouten,
Yes.
Mr. Spadoni,
Yes.
President Tornatore,
Aye.
Dr. Weeks.
Aye.
Mr. President, the motion passes.
Thank you. Moving on to unfinished business. Do we have any unfinished business for the board? Do we have any new business to be brought before the board? Okay, our next meeting is November 12th, 2020. Karen, Penny, I assume we still are going to have an executive session regarding the minutes?
Yes.
Okay. And given the fact that it wasn't on the agenda, and I understand we're not going to be taking any final action, Luke, I'll defer to you. Do you want to move us in and out of executive session, or do we want to just cut off the public and stay on it since we're not taking any final action? How do we do this? Okay. All right, before we do that, and before you cut the public stream, I'll entertain a motion to go into executive session. This will be for setting the price for sale or lease of property owned by the public body per 5 ILCS 120/2C6, semi-annual review and consideration for release of previous executive session minutes between March 2020 and September 2020 per 5 ILCS 120/2C, subparagraph 21. Do I have a motion to go into executive session?
So moved, Lanny Wilson.
Second.
Moved by Dr. Wilson,
Second.
second by who? Who's that? I'm sorry.
Bob
Whoever.
Larson.
Bob Larson, there you go.
Okay, seconded by Member Larson. A roll call, please.
Dr. Wilson,
Yes.
Ms. Bottoms,
Yes.
Ms. Finch,
Yes.
Ms. Geider,
Yes.
Dr. Hussein,
Yes.
Mr. Larson,
Aye.
Dr. Manier,
Yes.
Dr. Scouten,
Yes.
Mr. Spadoni,
Yes.
President Tornatore,
Aye.
Dr. Weeks.
Aye.
Mr. President, the motion passes.
Okay, the motion carries. We will go into executive session as soon as Luke tells us that we are no longer streaming. Okay, we are back, public, back into the meeting. We have moved out of executive session. There being nothing further on the agenda, I will entertain a motion to adjourn.
So moved, Wilson here.
Motion by Dr. Wilson. Is there a second?
Second?
There is a second by multiple people. Well,
I will defer my second.
Roll call, please.
Dr. Wilson,
Yes.
Ms. Bottoms,
Yes.
Ms. Finch? Yes. Ms. Geider?
Yes.
Dr. Hussein?
Yes.
Mr. Larson?
Aye.
Dr. Munir?
Yes.
Dr. Scouten?
Yes.
Mr. Spadoni?
Yes.
President Tornatore?
Aye.
Dr. Weeks?
Aye.
Mr. President, the motion carries.
Thank you. We are adjourned. We will reconvene on November 12th, and I long for the day when we can all get together again. And on that day, pizza for everybody and me. So.
Okay, good job.
Sounds good.
I look forward to that.
I want that in the minutes.